I'm going to be demonstrating passive, active assisted, and active range of motion on my patient. And this is very important because range of motion can reduce the risk of contractures, it promotes blood flow, it gets more mobility in the joints, and it overall just gets your patient moving, and it can increase strength if you're progressing them from passive to active. So the first thing we're going to do is scapular protraction and retraction. So I'm going to start with passive range of motion. So passive range of motion means that you're moving the patient through the movement and they are not doing any work. So we're going to come forward, and this is protraction, and while we come back, we're coming back into retraction. Active assisted would mean that the patient's helping you a little bit, and active would mean that the patient is now able to do it on herself. All right, I'm gonna have you turn onto your back. The next one is shoulder flexion and extension. So as we come up, this is shoulder flexion. We're gonna come all the way down. That would be shoulder extension. And then we'd again have the patient actively do it with assistance, and then we'd have the patient be able to actively do it. The next thing that we could do is ab and adduction. So for abduction, we're coming out passively. Adduction will be coming across the patient's midline. Active assisted. And then finally active. And the last one we're going to do on the shoulder is external and internal rotation. So for external rotation, we're going to start here, which is neutral. We're going to come up. And then for internal rotation, coming down. Then we'd have the patient actively assist us. And then finally do it actively. The next thing we can do is elbow flexion extension. Extension. And while we're doing these, we want to do the movements at least probably 3 times. So, and then active. Good job. The next thing we can do is pronation supination. So pronation is when the palm of the hand is facing down. Supination is when the dorsum of the hand is facing down. And a good way to remember pronation versus supination is if you picture like this is a cup or a bowl of soup, this would be supination. The next thing you can do is wrist flexion extension. That one's pretty easy. Radial and ulnar deviation. So radial deviation is coming towards the thumb side, so radial. Ulnar deviation is coming towards the pinky. So again, we would do this actively assisted and then active. The next thing we're going to do is hip flexion extension. So for hip flexion extension, you're going to want to support the patient's knee. We're going to come up. This would be hip flexion, and have them actively assisted do it, and then actively. And I'll show hip extension in a couple minutes. The next one is hip ab and adduction. So I'm going to readjust my camera. I'll do it on this side. Hip abduction is taking away from the midline, so we're coming out. And adduction would be coming across the midline. And we'd actively assistedly do this. And then the patient would be able to do it on their own. And this is all promoting strength and promoting blood flow. The next thing we can do is hip internal and external rotation. So external rotation is turning the leg out. Internal rotation is turning the leg in. So actively assisted, and then active. Good. And the next thing is knee flexion extension. So while we're holding the hip in flexion, we can flex the knee, extend, active assisted, and then active. Good job. We're now going to do dorsiflexion and plantar flexion. So plantar flexion is coming down, pointing our toes. So I want to bring my patient passively through this, then actively assisted, and then active. Dorsal flexion is coming up. So passive, active assistive, and active. You can also do inversion and eversion of the ankle. So inversion is bringing the ankle in like this, and eversion is coming out. And we can also do toe flexion extension. So that would just be curling the toes for flexion, extending the toes for extension. And those are the different range of motions and why they're important.